In this video, we'll explore the assessment and management of a patellar tendinopathy in a 19-year-old competitive cheerleader. The client presented has gradual anterior knee pain that has developed over a period of 6 months, mainly during cheer drills, running and jumping activities. The athlete reported pain localized to the apex of the patella, with stiffness periods after sitting, which is a typical sign of tendinopathy. His symptoms were aggravated by high-impact activities such as jumping, running for more than 5 minutes, cheer routines, but rest seems to be fine. The aim of this session is to reduce the athlete's pain by performing isometric contractions of the quadriceps. This is basically where you put the muscle under load and tension without changing the length.
Hi, my name is Morgan Davis. I'm a practitioner here at Cardiff Met. I'm here with a cheerleader who's been experiencing tendinopathy pain in the apex of a patellar tendon for the past 6 months. I understand that he cannot run, it gets aggravated when he does that, and he can't do single leg exercises such as split squats or lunges. So, knowing this, I've chosen to do isometric contractions for this, and choosing the exercise of my choice is a wall sit. The reason I chose this is because isometric contractions can help with reducing pain and while loading the tendon without lengthening or shortening the muscle. So knowing this, do I have consent to currently run? Okay, so moving on to the movement now, we're doing an isometric wall sit, a quadriceps, patellar tendon. So what you want to do is start the position by getting against the wall with your back completely straight against the wall. Make sure your head's moving forward, yeah? Engage your core, act like you're about to punch in the stomach, so like your back's in a neutral position. Slide your back down into your knees at about 90 degrees and your thighs are parallel to the floor. And hold this position for 15 to 20 seconds. Once time's up, and you should just slide back up against the wall and push up. Okay. So now that you've seen me demonstrate the movement, could you perform it for yourself, please? Remember the coaching tips: feet shoulder width apart, back completely straight against the wall, engage that core, and then you can punch to the stomach, slide down, perfect. And so you can turn that 90 degree, perfect. How was the pain? Is it okay? Yeah. Out of 10?
I'd say 2 out of 10.
Perfect. If it goes above 3, let me know and we'll stop the movement.
Perfect.
As you see here, I have asked the athlete what their pain scale on 1 to 10 is. The athlete then said a 2, which is perfect. We do not want it to go above a 3, as we do not want to aggravate the athlete's injury more.
And slide back at the wall. Perfect. So now that you've seen me perform the movement and you've performed it yourself, I'm going to show you a regression to that, just in case it was a little bit hard for you, as a little bit of an easier exercise. So what you want to do is get to the exact same position, feet shoulder width apart, back flat against the wall, engage that core, so imagine you're being punched in the stomach, neutral spine, look straight forward. And instead of going down to 90 degrees, you just want to go down and not bend your knees fully, and just stay in that position there. This will be slightly easier,
So for the reason I have chosen these movements today is that isometric contractions can reduce pain sensitivity both locally and centrally. And they can also reduce the risk of atrophy in periods of immobilization, such as being injured when you can't play your sport.
Once that time's up, just slide back as per usual. So additionally to the regression and normal exercise, there will be an alternative one, which is a progression, if you found that the first exercise too easy. It will involve a 5 kg weight, and it'll be the exact same as last time. Shoulder width apart for feet, back against the wall, engage that core, neutral spine, upright posture, look forward, and hold the weight to your chest. Go down to that same 90 degree flexion in the knees, thighs parallel to the floor, and just hold it. 15-20 seconds again. Now once that time's up, again slide up the wall and just come up.
Brilliant.